Hey everyone, thanks for tuning in. I'm Dr. Parker, Dr. Hales here from Hales Parker Dentistry. Today we want to talk about communication. Communication is the most important aspect of you having better outcomes with your dental health and your dentist. So we want to take a couple minutes, talk about a book that we spent the better part of a year with, this Crucial Conversations book. We've trained ourselves and our team on this book for the last year. We highly recommend this book to our patients as well. It'll help you in communication and better health outcomes in all sorts of relationships in your lives. And Dr. Hales, communication, doctor-patient relationships, all about trust, and communication helps build that trust. Talk to us first a little bit about what our patients can do to better communicate.
Yeah, so communication is all about talking and how we can talk better, basically. And so when we're working with patients, we try to explain, hey, here's a lot of information and here's education on the dentist side of things, but we really want you to be able to feel like you trust us enough to express how you're feeling. And because we can give you as much information as we can, but if we don't understand your side of it or what's going on, then we can't create that game plan of where we want to be. And so it's all about communicating to really building that relationship with one another and understanding that.
Yeah, and the first point that we want to make out of this book is starting with heart. So to start with heart, you have to look at yourself and figure out what you want out of that relationship and then communicate that. So when patients communicate with us the relationship and the outcome that they want from us, that helps us a lot in understanding how to tailor the treatment and the care for you. And so if we think about let's say a billing issue, insurance makes things complicated, and that's probably the biggest issue that we ever run into at our office because we focus a lot on the relationships with our patients, and sometimes insurance can put a wedge in between that, creating some confusion. So, Dr. Hales, talk about a billing issue with a patient. How can they start with heart in communicating with us on that?
Yeah, so we always try to do our best to understand how insurance is going to work and give you the breakdown of what the cost is going to be. And a lot of times insurance, because the way that they set up, they end up trying to bill more or they try to pay less, right? Which makes you guys have to pay more. So a lot of times you'll get a bill in the mail saying that you owe us more money, okay? And the whole goal is that we just need to communicate that. We try to do that communication before, and sometimes we have to do that with the bill. So you get that and you give us a call, and really it's about, we want to be here for you and be able to figure out a plan of what's going to work for you. We understand that in your life what's going on, and that's where the trust really builds, so you can explain those situations and then figure out, okay, well, here's where we're at and what's the solution and how are we going to figure that out. So really coming together, right, between the patient and the doctor, and our staff is really good at it. And so, we've had them read this book and understand it for a year, so hopefully they're a little bit better at it now than before.
Oh, yeah.
But that's why we wanted to talk about with the patients too, right? If this is something we're implementing in our lives, it's not just for the business, it's also for that personal life as well, so.
Yeah. One of the other aspects we want to talk about is perspective and stories. So our communication is dictated by our perspective and the stories that we tell ourselves about the situation that we're in. And in a relationship like from a dentist to a patient, that is a very difficult bridge to gap because the perspective is very different. You're taking someone that's an expert and very experienced in dentistry, and you're taking a patient that has very little experience in dentistry and knowledge and assessing their own situation. And so perspective and the story that you're telling yourself is important to realize and understand and then communicate that with us here, because honestly we want to help, and that's our desire. We show up every day to help people, and we go home at the end of each day feeling good about the ability to help people. So by you explaining your story and your perspective of the situation, that's going to go a long way to us helping you out and solving either the problem or addressing the issue for you. So talk to the patients, Dr. Hales. Let's say they've come in, they've got an issue with the tooth, and as the dentist, you understand what's best for that tooth. But let's say for the patient, that sounds scary, or it sounds expensive. It sounds like something that maybe they can't handle in their life at this time. Talk to them about what they can do to communicate better with us.
Yeah, so first of all, no one likes pain, right? So a lot of times when you're already in pain and you come in and you're, a lot of times it's just hard to take all that in. And when you can actually express your story, it puts it more on a personal level for us, right? And that's what we love, is being able to really get down, understand who you are as a patient, so that we can come up with the best outcome, But we also want you to feel comfortable communicating with, hey, how do you feel about this treatment that we're recommending, right? We're saying, hey, if you need all this work done, lots of crowns and things like that, and you don't feel comfortable with that, then that's when you need to communicate and let us know, right? It's not just about me telling you, hey, I'm a doctor, you need to listen to what I need to say. It's about, hey, this is what I'm recommending. Now you tell me your story, right? And what is it that you need to express about how you're feeling through this all?
Yeah. If you're more empowered to inform us on that situation and communicate to us that perspective that you have, we're more empowered and we have better tools to help you and be better doctors for you. So we always are striving to create a safe environment in our office for good communication, because we understand how important that is to achieving better outcomes. Because to us, what we specifically do for a tooth isn't as important as you, our patient, being healthy and feeling good and confident that we've done the best for you in your situation at the time. So if you've got time and looking for some improvement in your communication, we recommend this book highly. And we encourage you to communicate well with us here, because that makes things more fun and better. Anything else to add, Dr. Hess?
Yeah, like I said, this book has been great. So give it a read. It's pretty quick and easy. And then you share it with those. And I had my wife read it, told her it's really good, and it's helped in our communication at home. And so, like I said, it's every aspect of it. So, but hopefully you like it, and let us know what you think about it as well.
All right, thanks for tuning in.